Okay, this is Mrs. E.W. She's coming in her first pregnancy. She's 28 weeks and 5 days with dichorionic twins, twin one cephalic. She came in overnight on the 25th with a history of contractions. Came round to the delivery suite and commenced on a Tosabam. She's now had 2 doses of betamethasone. She's no longer tightening. She had an examination this morning and the cervix isn't progressing, and the Tosabam is now finished this morning.
Okay.
What is the lie of the second twin?
It's transverse.
Okay, so we've got dichorionic twins in premature labour at 28 weeks. Has been on tocolytics and had steroids and now is static.
I'm a bit concerned about the second twin not being cephalic head down because it's transverse, and I would think there might be difficulties expected in the delivery. Should we be considering a caesarean section or offer it to her at this stage?
Because we haven't got hard and fast evidence and guidelines, we have discussed the uncertainties that surround how to proceed with the patient herself, and I think she understands all the pros and cons, and she herself feels that she would prefer not to have a caesarean section unless there is some clear reason for doing so. So the short answer is that we don't have anything hard and fast for this that I'm aware of.
Okay.
And I don't think anybody else has either.
I can have a look to see if there's evidence. Can we just clarify the question? Our population is...
Sure, the patient group here will be preterm twins with the second twin non-cephalic.
Okay.
And so we're looking at caesarean section, which will be an intervention, and compare it against vaginal delivery. And the outcome measures we'll be looking at will be fetal and maternal mortality and morbidity. I'm on call tonight, so I'm just wondering if she does go into proper labour, and what can we do to
I mean, it may be that we have enough time to get the answer back. I mean, she could stay like this for some period of time. But we have discussed the uncertainties with her. We've explained to her as much as we can what the pros and cons are. And I think that she would like to avoid a caesarean section. So I think that we go ahead if she goes in labour with a view to a vaginal delivery. Obviously, if there are indications to the contrary, then we follow those. But I think that that's the way that we should go, unless we get this information back and it dictates something different.